Hi, welcome back. Dr. Tony DeRamus from Sandstone Chiropractic and Velosia, Kibe. Thank you. Let's start with you. When you talk about back pain, which there are millions of Americans who are struggling with back pain, there are all kinds of ways to take care of it, but oftentimes not 100%. You tried all kinds of things.
All kinds of things. Lumbar injections, rehab, aqua therapy, all kind of patches, pain medication. Prayer, of course.
And the reason why I say that is she's the pastor at Windsor Village UMC, so United Methodist Church, and so you just didn't have time to be down and out like most people.
I didn't, and it was so disconcerting because it interrupted everything in my schedule, my life.
It's debilitating.
And very debilitating, and I was in such chronic pain. I was always checking my watch to see if it was time to take another pain pill.
Which causes other issues.
Yes.
All right, so how did you find out about Dr. Tony and Sandstone?
Watching your show.
Oh, there you go. Yeah. And it's funny, Dr. DeRamus, because a lot of times people won't start there with chiropractic because they feel like chiropractic wouldn't be something that's strong enough to take care of that kind of pain.
Yeah, and you know, I would prefer them to come to us first. It would save them a lot of money and time, but I also like the cases that have been through everything. They've ruled everything else out. I like the complicated cases, as she was. So either way.
Yeah, and then because the thing with pain medication is not getting rid of the problem; it's just covering it up so you can get through.
Yeah, and pain medication, what people don't realize, we need our nervous system to be able to heal. And with pain medication, we slow that process down over time. And then we have the issue with the addiction part of it too.
Yeah. All right. So what did you do with her, and how does that help the body help itself to heal?
Well, you know, the first thing and primary thing you have to do is you need to look at the body a little bit differently. When we take our X-rays, we're looking at the body and how it's balanced. And if you look at her X-rays, her head, which should be over the top of the body, was about 35 millimeters off to the side. And we have a saying that wherever the head goes, the body will follow. And then from the side angle, you shouldn't have more than 15 millimeters of movement. She was 35 millimeters forward there as well. So we do everything to try to bring the body back into center.
So this is about alignment here.
It is about alignment, but there's so many other things because most people that come to us are just damaged beyond repair at that point. So we use some pretty advanced.
The longer you go, the more damage you can cause in some cases.
100%. And some of these people that come to see us have been developing this for 20 or 30 years.
Yeah. Because they felt like there's nothing else that would work.
Absolutely.
Okay, so you used what on her to make her better?
Yeah, there's several things we use in our office. One is spinal decompression, which most people have heard of as 4 herniated discs, which she was diagnosed with. But we have some new equipment as well. One that's called PEMF, or pulse electromagnetic therapy. I looked at this probably 2 years ago and thought it was quite expensive for the box and so forth. And I have a motocross rider who was in a severe accident, compression fracture in his spine. Well, he was going to fly to California to do this as part of his treatment program. So I said, well, look, I've got to get the machine in. Was absolutely surprised by the results. Looked at the research on it. Johnson Space Center did most of the research. It's actually in the spacesuits now for muscle atrophy and bone density reasons.
Oh, wow.
So we used that with her. Now,
what's it doing to the body?
The simplest explanation of this is it's your body carries a certain voltage. Every one of the cells carries a voltage of negative 70 to 110. And when we get sick or disease or toxins in our body, that voltage then goes down. And so this essentially,
like a weak battery.
It's exactly like weak battery. So we're essentially recharging the body at a cellular level so it can begin to heal itself.
Okay, and then cryotherapy is another therapy that you all use.
We use that. We did that. We have a lot of athletes. I do a lot of jiu-jitsu, so I'm in there quite a bit myself. But when you look at the general population, most of us carry way too much inflammation as it is. Inflammation is now being looked at as being a cause of cancer, heart disease, osteoarthritis. So we need to do something to bring that down without taking medications.
When the body has a lot of inflammation, it's telling you there's stuff going on here that we're trying to fight and we can't do it.
It is a warning signal, and if we're arbitrarily just bringing it down without trying to treat the underlying issue there, that could be an issue as well.
All right, so when you had your treatments done, what changed?
Everything. My daily schedule changed. Of course, the pain left. I just feel like it was a godsend. It's really like a miracle.
This is where the prayer worked, right?
Yes. It was a miracle because my whole lifestyle was put back into sync, into normal. And so I'm very grateful to Dr. Tony and for all of the treatment that I'm receiving.
Because otherwise you might not have been here this morning because you couldn't get out of bed.
Right. And there had been times that I could not get out of bed without help.
Wow, this is amazing. All right, Dr. Tony, if you could explain to folks, when you say chiropractic medicine, it's a wide range, and every doctor has a way that they practice, and so I think sometimes people misunderstand what chiropractic medicine is.
It's the philosophy. It's how you look at the body. The body was designed to heal itself. We are trained to look and identify what's interfering with that process, and then remove it. And that means we could look at nutrition. We could look at the typical chiropractic adjustments. But if you have that philosophy going into it, then you do a little more detective work. You can start just like the X-rays we looked at.
What went wrong, and how do we right the ship?
Yeah, absolutely. And then you have to actually have some pretty advanced stuff too to push it as well.
You just talked about,
absolutely.
but that's amazing.
Yeah.
So congratulations,
Thank you.
and thank you very much. To learn more about PEMF therapy and cryotherapy at Sandstone Chiropractic, call them at 936-851-1631, 936-851-1631, or log on to sandstonechiro.com. And as you say, at least give that a chance first before you get into the deeper things like surgery.
Absolutely.
All right. If the idea of heart surgery makes your pulse race, we'll tell you about a minimally invasive procedure that can have you out of the hospital in 1 or 2 days.
Kate Hudson.